The head of the KwaZulu-Natal Research, Innovation and Sequencing Platform, or KRISP in short, Professor Tulio De Oliveira, says scientists are monitoring other variants of the coronavirus that are not yet of concern. KRISP has been conducting research into the variant found in South Africa, with funding for the research coming from the Department of Higher Education, Science and Innovation. So part of the research found that persons infected with the variant found here in South Africa have developed antibodies to guard against reinfection from other variants of the coronavirus. KRISP's Tulio De Oliveira, Professor Tulio De Oliveira, joins me now live. A very good evening to you, Prof. Thanks indeed for your time. So what do these results mean for people who recently contracted COVID-19? Are they safe from reinfection categorically?
Okay, good evening, and good evening to all your viewers. So in these results, what it mean, the results? So I will explain first for your first question, what it means for people that had recently infected. What it means is that what we found is that people that got infected in the second wave, which of course was dominated by the variant, had very strong antibody response. And this antibody response first could neutralize the variant itself, which we expect that, but this virus has been so unexpected in many ways that was fantastic to confirm these results, especially because the level of the antibodies that were developed not only could neutralize the variant, the 501YV2, but also show good neutralization against the previous variants or the previous lineages circulating in South Africa, which is quite similar to other lineages around the world. So what it means? It means that at least for a few months, it's most likely that people that was previously infected will have strong antibodies that may protect them from second infection.
You know, what would be interesting to know, though, do we know if that immunity in that group decreases over time? Do these people go ahead and get vaccinated when the time comes?
Yes. So the answer for your question, it is yes to both of them. What we know from SARS-CoV-2, we know from the other lineages, and we expect to be the same for this new variant. But again, we are working around the clock with a large group of very competent scientists to answer that questions. Is that over time, normally you have a decrease on the levels of antibodies. And so what it means is that if as time passes, people will have less antibodies that would potentially protect them from secondary infection. So what it means? It means that people that was recently infected still should be vaccinated, because the main objective of a vaccine is that if you get infected, if you can break through your natural defense of the antibodies, you don't develop disease. And that's what the Johnson & Johnson and the Pfizer vaccine show, very high efficacy on development of disease. At the moment in South Africa, our key priority is to vaccinate frontline healthcare workers. And we believe that we should keep on that focus despite them being infected or non-infected. And then as we move to the other age groups, which will be then with high comorbidities and people with advanced age, we will also engage them on the vaccination. But the good news about this scientific discovery is not only that our current vaccines are effective, that we are rolling out against the variant, but that it's a race around the world to make even what we call the next generation of vaccines. And this discovery, it means that if a vaccine can elite and can neutralize our variant, is likely to neutralize all the other lineages and variants in the world, which put a lot of interest on helping South Africa to not only vaccinate the population, but to develop very effective vaccines, because it would help not only South Africa, but the whole world.
of course, Prof, but do you think there's still that possibility of a third wave in South Africa? If that possibility still exists, then one certainly cannot rule out, or you'd correct me if I'm wrong, the possibility of a new variant. I guess with the possibility of a third wave, that possibility also still exists in science. Am I correct?
Yes and no. Let me explain to you. The first one thing that we know in general, not about science, but the history in general, is that history tends to repeat itself if you don't change anything. One thing that I personally worry, it is that if we are not careful, we are going now to our holiday season, Easter season, and if you're not careful, it may look quite similar at the end of the year, that we try to overcompensate with parties and seeing people that we haven't seen and traveling. And I think that would be very important to South Africa and the citizens and people that live in the country to try to quite be careful, because if we can behave a little bit better, not like the end of last year, and some like that, we may avoid a very large third wave. And what's very important of try to avoid a very large third wave early is because as we vaccinate people, we want to vaccinate people before you have a large number of infections, because then if that's the case, we're going to have a much lower mortality. And I think that we have been already traumatized from 2 waves, and everyone in the country knows someone that have suffered. So what I would plead, not only for the public, but for the public health, is try to really focus in the next few months to try to not compensate and go more than back to normal, but to try to still keep the basic control of the virus from both test, contact tracing, and isolation, but also from people trying to behave in small groups, using masks, and try to keep social distancing.
Prof, I want to bring in a tweet from one of our viewers, Sonwabile Spaidile. He's asking whether, does this mean that they're safe from COVID itself as well as just the variant? I think many are asking that question, asking for lots of clarity on that.
Okay, so let's just bring more a little bit of clarity.
Yes.
So normally the variant, what we call a variant or a lineage, it is a virus that is having a given number of mutations. What we call COVID ID is the disease that infection develop. So that's why one can still have variants and virus, but not very extreme disease. And that's the main objective of vaccines. The main objective of vaccines are not to stop transmission of the virus or the variants, but is that people that may get infected don't develop COVID ID or the disease, which is normally associated with pneumonia, a pneumonia caused by SARS-CoV-2. So what it means in simple terms, it means that what we have produced today is good news. Is good news that should strengthen our focus on vaccinations. It's good news that should strengthen our focus on use science in real time to understand the variants and the pandemics. But it's also good news and more important to us to keep our behavior quite focused, because if we can expand vaccination and avoid this overcompensation with behavior that may give rise to an early third wave, we may be out of the woods of this viral pandemic probably in the next few months, or at least by the end of the year.
That will certainly be very good news. Thank you very much indeed, the head of the KwaZulu-Natal Research, Innovation and Sequencing Platform, KRISP, Professor Tulio De Oliveira. Thanks for joining us here on the program.